If you're asking, does UT cause headache, the real answer is a little tricky. A simple bladder UT usually shows up with urinary symptoms first, not head pain. But sometimes a headache appears because your body is stressed, dehydrated, feverish, or dealing with a bigger infection. A lot of people miss that clue because they expect one neat symptom list. Instead, they get burning when peeing, urgency, pressure, fatigue, and then a dull headache that makes everything feel heavier. That mix can be confusing, especially if they also deal with migraines or tension headaches sometimes. The easy mistake is assuming the headache automatically means something unrelated or something dramatic. Sometimes it is simply your body's alarm system reacting to infection, lack of fluids, poor sleep, or rising fever. In other cases, it may suggest the infection is moving higher and hitting the body harder. So in this video, we're breaking down when a UTI and headache can show up together. When the headache is probably indirect, when it becomes a warning sign, and what simple steps can help you respond faster without spiraling. Let's start with the part most people actually want to know. A UTI can be linked with a headache, but headache is not one of the classic first-line symptoms of a simple lower UTI. Typical bladder infection symptoms are burning, urgency, frequency, pelvic discomfort, and sometimes blood in the urine. That's why this question feels frustrating. You may have a headache and urinary symptoms at the same time, but that does not always mean the UT directly caused the head pain in a clean, obvious way. Sometimes both are happening together because the body is under stress. Headaches become more believable when the infection also brings fever, chills, nausea, poor sleep, body aches, or dehydration. That is when the problem stops feeling like a local bladder irritation and starts feeling more like your whole system is being affected. Think of it like a small leak in a building. If the leak stays tiny, the damage is local. If the water spreads, other rooms start showing problems. That is why context matters more than the word headache by itself. Here's where people often get stuck. A lower UTI and a more serious upper UTI can overlap, but they do not feel exactly the same. A bladder infection often stays around burning, urgency, lower belly discomfort, cloudy urine, or that constant feeling that you need to go again. A headache may sneak in if you are not drinking enough, running a temperature, sleeping badly, or simply feeling wiped out. Dehydration itself can cause headache, and infections that make you feel unwell can amplify that. So the headache may be real, but not the main diagnostic clue. When the infection reaches the kidneys, the pattern often looks rougher. You may see fever, chills, back or side pain, nausea, vomiting, and a much more flu-like feeling. In that setting, a headache makes more sense because the illness is affecting the whole body more aggressively. So if you have urinary symptoms plus a headache, the smarter question is not only can a UT do this, the smarter question is what else is happening with it. That is where the real answer usually lives. Now for the breakthrough. Headache is often a side signal, not the star of the show. It may appear because you feel feverish, dehydrated, exhausted, or generally ill. That means the presence of a headache matters less on its own and more when paired with the rest of the symptom pattern. If the headache is mild and you mainly have classic bladder symptoms, the UTI may still be limited to the lower urinary tract. But if the headache comes with high fever, shaking, vomiting, side pain, or a sudden drop in how well you feel, the picture changes fast. In older or frail adults, confusion or sudden behavior change can also show up with UTS, which is one more reason not to oversimplify the situation. The body does not always read from the same script, especially when age, illness, or dehydration change how symptoms appear. So the key insight is this. A UTI can be connected to headache, but headache is usually a clue to the body's overall stress level, not the defining sign of a basic bladder infection. Once you see that, the whole topic gets easier to understand. So what should you do if you suspect a UTI and your head is hurting too? First, pay attention to the urinary symptoms. Burning, urgency, frequent peeing, cloudy urine, pelvic pressure, and blood in the urine tell you much more about a UTI than the headache alone. Second, look at the body-wide signs. Are you feverish, chilled, nauseated, unusually weak, or sore in your back or side? Are you barely drinking because peeing hurts? That combination matters because it can point toward dehydration or a kidney infection, rather than a simple bladder issue. Third, do not self-diagnose only from smell, color, or internet guesses. A clinician may use your story, a physical exam, urinalysis, urine culture, blood tests, and sometimes other tests depending on how sick you are. Good treatment starts with naming the problem correctly. And fourth, do not keep pushing through for days if symptoms are getting worse. Headache plus urinary symptoms plus fever or flank pain is not the moment to be tough. It is the moment to get properly checked. Treatment depends on what is actually going on. If it is a bacterial bladder infection, a clinician may prescribe antibiotics, and recovery often also includes fluids, rest, and symptom relief. Drinking enough to stay hydrated can help, and pain relievers may be used if a clinician says they are appropriate. If the infection has spread to the kidneys, treatment becomes more urgent. Some people need stronger monitoring, longer antibiotics, or even for treatment if they are very unwell. That is one more reason not to brush off a UTI that suddenly starts feeling like a whole-body illness. Your job at home is not to play doctor. Your job is to notice the pattern early, avoid letting dehydration build, follow the treatment exactly as prescribed, and finish antibiotics if they are given. Stopping early because you feel better can let the infection come back or worsen. And one more thing, if you get headaches often anyway, do not assume every headache during a UTI is just your normal pattern. The surrounding symptoms decide whether it is routine discomfort or something that needs faster medical attention. There are times when the answer stops being educational and becomes urgent. Get prompt medical help if urinary symptoms come with high fever, chills, back or side pain, vomiting, confusion, trouble speaking, severe weakness, or if you have not peed all day. Those are not casual warning signs. Pregnancy also changes the threshold. UTIs during pregnancy deserve quicker medical attention, and kidney infection symptoms while pregnant are treated as urgent. The same goes for people who are older, frail, immunocompromised, have catheters, kidney issues, or frequent repeat infections. And if the headache itself feels extreme, sudden, or unlike your normal pattern, do not assume a UTI explains everything. A severe or unusual headache still deserves its own medical judgment, especially if it comes with confusion, fainting, weakness, vision trouble, or trouble speaking. The goal is not fear. The goal is accuracy. A mild headache with a simple UTI can happen, but a headache paired with major red flags is your cue to stop guessing and get real care before a manageable infection becomes a much bigger problem. So, does UTI cause headache? Sometimes yes, but usually indirectly. A simple lower UTI is more famous for burning, urgency, and pelvic discomfort. Headache becomes more believable when fever, dehydration, poor sleep, or a spreading infection start pulling the rest of the body into the story. That is the main takeaway from this video. Do not treat headache as the main proof of a UTI, and do not ignore it when it arrives with stronger warning signs. Read the full pattern, not just the loudest symptom in the moment. This video is for education only and is not a diagnosis or a substitute for medical care. If you have severe symptoms, confusion, high fever, back pain, vomiting, or a sudden intense headache, get medical help right away instead of relying on online content alone. If you want more easy-to-understand videos on headaches, infections, and real-world health questions, subscribe to the channel. And if this helped, leave a comment with your experience, question, or suggestion so we can make the next video even more useful.